Well, hello. Welcome to Beating Cardiovascular Disease, the special 4-hour presentation of Beating Cardiovascular Disease. Probably the most important presentation that I have ever given to physicians, because this particular presentation has made such an impact in physicians going back to their practice and making meaningful change in how they take care of their patients. For approximately 11 years, I used to teach cardiovascular disease state issues, including all the biomarker information, but I would get an hour here and an hour and 15 minutes here and maybe even an hour and a half at this location. The physicians and clinicians listening would get very excited. They would shake their heads up and down, ask questions, leave enthusiastic. But after looking back over those 11 years of doing just that, I couldn't see where we were making that much impact as far as the number of doctors able to do this and do it well. So I was discussing this with a prominent person years ago, and I explained to her that the reason I think doctors aren't going back and making meaningful changes, you can't explain something this complex in just an hour presentation or an hour and a half. And she asked, how long do you think it would take? And when she did that, I was taken aback, because I realized I was talking to someone who could potentially make a difference in this particular problem. And I thought for about 10 seconds and I blurted out 4 hours. And she asked me to make the presentation, and she would set up the meeting. And sure enough, when I made this presentation and we did the first meeting here in Jackson, Mississippi, we had a good response. And essentially each clinician that came to the meeting went back to their practice and made meaningful change. It was so exciting. We decided to take it to another place, and we went to Tampa, Florida, and there were about 30 plus physicians there, and almost each physician in that meeting also went back and made meaningful change in how they took care of cardiovascular patients. And we realized then we were onto something, because in 4 hours I was able to explain it adequately in such a way that the clinicians listening could understand it. Now, in this particular setting, it's going to be all the better, because you can listen to what I have to say, you can play things back, and you can listen to segments at a time and then come back the next day and listen to segments until you get through the entire 4 hours. Or you can listen to it all in one setting and come back and listen to several more. But however your learning process takes place, this is your chance to become incredibly good at beating cardiovascular disease by simply understanding how this disease takes place, how to use these advanced cardiovascular biomarkers in a meaningful way, how to add certain history and physical exam points, when to use certain ancillary tests. And before you know it, you're going to have great control over this disease state in your patient population. And if each clinician that took care of cardiovascular patients would actually spend the 4 hours and then build on that information later on, we would see cardiovascular disease plummet in the United States. For the past 15 years, we've had very little cardiovascular events occurring out of my practice, but yet I have an extremely high-risk practice. We have patients from multiple states at my clinic, and they come from long distances, from California all the way to New York. And when you looked at these patient cases, people that travel that far to get care, they're always in a rather serious condition. However, when we applied these principles with each one in a diligent manner, they each got better. Many of the patients that had been sent to me in the past were almost like Hail Marys. You know, in a football game where you got 3 seconds left and you're 60 yards away from the goal line, and your quarterback lets the receivers go out long, and with all his might he throws the ball in one direction, hoping that one of his receivers will be the one that gets his hands on the ball and catches it and draws it in. But you know, Hail Marys rarely work in football. However, in this particular setting, when you understand this information, Hail Mary type cases are achievable and beatable in your practice. This is within each of our realm. I think we can safely say we can beat cardiovascular disease with this information in almost every case. And wouldn't it be nice if the 1.2 million people that die from heart attacks, strokes, and heart failure each year didn't have to die? And wouldn't it be nice if the 5+ million patients that have been maimed by this disease didn't have to be maimed? Wouldn't it be nice if cardiovascular disease just became very rare in our lifetime? Well, that's the goal of this particular presentation, is to get it one step closer to becoming rare. I hope you'll pay attention. I hope you'll email with questions if you have problems. Let's go through this process and learn how to beat cardiovascular disease in a meaningful way in your practice and in my practice. As a disclaimer, I do work for several speaker bureaus, including the Health Diagnostic Laboratory, Singulex Laboratory, AstraZeneca. I'm going to be using the names of various medications, and oftentimes I use brand names just out of conversation because doctors in private practice typically do use brand names. It's considered to be more proper to use the generic names in giving these presentations, but I've learned through experience, oftentimes when I give those names, physicians don't know what I'm talking about, because in the real world setting, most doctors are using brand names in most cases. So if I use the brand name, you've got this list to go back to compare to the generic or vice versa, and that way each person can know what we're talking about in each particular medication discussed. Now let's talk about the scope of what is going on in America, because this disease state is so large that I believe you would have to search far and wide to find someone that's not impacted by this disease. Actually, if you look at the number of deaths from heart attacks and strokes, it's about 780,000 plus patients per year. And this has been going on for some length of time, and it's not going down near as fast as it should with the available information that we have. I personally believe with all my heart that almost all of these deaths could have been avoided. And so let's discuss why I say that and what I'm talking about. If you went back a few years and you remember the tornado in Joplin that devastated the area, and there were 158 people that died as a result of that storm. And then you went to Hurricane Katrina, which is closer to where I live. In fact, that hurricane came right through Jackson, Mississippi. You'll see that there were 1,836 that died as a result of that hurricane. And if you take both of those storms put together, that makes up 0.0026% of the number of deaths that we have with cardiovascular disease every year. Said another way, if you take the completion of both of those storms and the total deaths from the tornado in Joplin and the Hurricane Katrina that came through Louisiana and Mississippi and moved up through the southern United States, you realize that the same number of people die almost every single day from cardiovascular events, meaning heart attacks and strokes. That puts us in a little bit different perspective. Sometimes we talk about numbers in medicine, and I think it's hard to gain perspective. Basically, you and I as clinicians are on the front line of a natural disaster, and you and I had the potential to prevent this natural disaster from occurring in our area to our patients. Said another way, if you went through every U.S. military conflict from the Revolutionary War to present day Middle Eastern conflicts, you'll find out that the number of deaths from cardiovascular disease yearly matched the number of deaths that occurred throughout all those skirmishes, all those military conflicts throughout the history of the United States. Obviously, we got that many deaths, so we're dealing with a very, very large number here. And the fact that you and I can do something about this, if you spend the time to learn this, would be so meaningful. If you look at a map, CDC information where cardiovascular disease exists is throughout the country. Some states have not reported as completely as others. Therefore, we have scattered information in some areas. However, if you look in that southeastern United States where I'm living, we're in a hotbed of cardiovascular disease. But why would I have so few heart attacks in my practice if we're in such a hotbed, especially when everyone sends their difficult case? For the last 15 years, I've had approximately one heart attack patient per year. And in the last 6 years, we've had absolutely 0 strokes that have come through my practice. Now, these are statistics that you can actually repeat in your practice too, because the things that I'm doing are certainly doable in every clinician's practice. It's just a matter of learning exactly how this disease takes place, casting a much wider net than we've been casting before. To become good at anything, it starts with attitude. People that have great attitudes toward whatever they're doing tend to have much more success than folks who don't carry the same attitude. For years, we've had struggles through medicine. We have business people taking over many of our practice and quotas to meet and various things that were never there in the past. And thus it's changed the way many of us are having to practice medicine. Sometimes that can impact your attitude and my attitude, and I encourage you to fight that and to make your attitude as wonderful as possible, because it's the patient that ultimately needs us to hang in there and to fight hard for them. And they need us to cast this net wide and to help them. They come into our office with a multitude of various attitudes. You see the various expressions on this young lady's face. These expressions are things that you might see in practice. This one comes rather concerned about cardiovascular issues you discuss. This one's somewhat flippant. This one is confused. This one is in denial. And you and I have to get that person from wherever that state is and that attitude to the place where they're receiving this information and actually doing something with it. You and I become the accountability partner for this patient, the one that has the eyes and the ears that can see and sense everything they're doing. Once you learn the advanced cardiovascular biomarkers, I'm going to teach you how to know when they overeat and how often they overeat. No longer will your patients be able to eat in the closet. I'm going to teach you through these markers when a person's exercise is adequate enough and when it's often enough. Then you can see if a patient is doing what they need to do to get better or if they're not. I'm going to show you biomarker information that will tell you when the artery is blocking in the heart, which will give you approximately 2 to 7 years warning before an artery in the heart becomes blocked to the point that the patient gets in trouble with a heart attack. We get approximately 6 to 8 months warning before a ruptured artery heart attack. And there's only 2 ways to have a heart attack, a blocked artery or a ruptured artery. You and I can see this with these numbers. I'm going to show you step by step how you can see a patient that's developing congestive heart failure. And you get 1.5 to 4 years warning before that takes place, so you don't even have to let congestive heart failure set up in your patient. You can catch what's causing it and stop it before it becomes a reality. Many of these disease states are occurring silently in our patient, and if you don't learn the biomarkers, you won't know how to actually effectively stop this disease state. You'll become that physician that's reactionary. Your patient develops angina, your patient develops serious angina, and then you have to react to this terrible advanced disease state, when if we had just done the advanced testing much earlier, you could have stopped it from ever getting to that point. That patient that's developing congestive heart failure, why be reactionary when they already have congestive heart failure when you could have caught them years earlier when they were developing it? You say, how do you know these things all take place? Well, we're going to go through all those things as we get through this process. I want to get to the heart of the matter with you, and let's make this thing happen. If you're going to be taking cardiovascular patients, whether you're a primary care physician, family practice, internal medicine, OB-GYN, or you're a cardiologist, or you're a neurologist, whatever your perspective, if you're going to be good at anything, I think we'd all want to be good at this, because there's nothing that affects our patient more than cardiovascular disease. If you look at the deaths that occur in the United States, more people die from cardiovascular disease than the next 4 causes of death put together. So what area of medicine would be more important to learn than this? You know, as clinicians, we spent many, many hours training to become a physician and to get our degree, and then to get our residency completed, and to get our board certifications. What is it to taking 4 hours now, learning this process, and then spending another 8, 12 hours and becoming much better at it, and before you know it, gaining excellent skills that helps you beat this disease equally to what we're doing at our clinic and other clinics that have learned this process. Now let's talk about this cardiovascular disease process, because I want you to understand how it takes place, so when we cast the net wider, you understand why and what we're doing. If you want to look at lipoproteins and how this is beginning to cause plaque development, and then look at the other perspective, plaque regression. If you have a process that builds plaque in blood vessels, why couldn't you have a process that takes plaque away? And the answer is you can, but someone's going to have to teach you how to do this. Years ago, I was doing carotid Dopplers with intermedial thickness and sending my studies to a radiologist in Georgia, a radiologist that read carotid Dopplers with intermedial thickness for 38 other physicians. The reason I know that is one morning he called me. He said, "Sam, I read carotid Dopplers with intermedial thickness for 38 other physicians besides you, and throughout all the years of reading their studies, I've never had a single case from any of these 38 physicians showing plaque regression. But at your clinic, plaque regression is extremely common. What is it that you're doing that's so different than these other 38 physicians?" And I wanted to tell you that my target is different, and I think that makes all the difference. You see, if your target is lipids and you think lipids are going to fix this disease, you do what you need to do to fix cholesterol, and you think that's going to make this disease go away. And I think inflammation is at the basis of it, and it's the inflammation that attracts these lipids to cause plaque progression. We've got two different targets in hand, and you see, if you're shooting at this target and the real target's over here, you're never going to hit the real target. So you want to aim at the target that's specific to this disease state. There are actually 8 disease states we're going to talk about in a few minutes that create inflammation that ultimately lead to this plaque development. If you were just aiming at cholesterol, you would only be aiming at one of the 8. How about diabetes? If you were treating diabetes, but that's all you were treating was the blood sugar related, not the inflammation related to the blood sugar, you've missed the target all over again. You see, I can show you hundreds of patients who have very well-controlled blood sugar, but do not have well-controlled inflammatory responses based on that blood sugar. A little advanced biomarker use and tweaking, and now you can have good control of blood sugar coinciding with good control of inflammation related to that blood sugar. It's understanding these biomarkers and the physiology tied in with the biomarkers that helps you understand why you want to do this. And before you know it, your patients aren't developing heart attacks and strokes, but they're also not developing small vessel disease. Things like peripheral neuropathy, chronic kidney disease issues, retinopathy. And it gives them a meaningful way of enjoying their life.